still, I'm sure he hasn't, no, he hasn't fixed it.
All right, so here we go. We're going to be on live on YouTube in like 3, 2, 1 or whatever.
Okay.
And then I'm also going to do record to this computer. So good morning, everybody. It is Saturday, July 19th. I'm just waiting for winter. July 19th, and Victoria DaCosta and I are here to talk about upstream intelligence and thinking about upstream root causes or nidus or seed or whatever you want to call it for downstream problems. And today we're going to talk a little bit about a case that happened to me a little while ago, a couple weeks now, and it was pretty dramatic and pretty thought-provoking. Victoria, you are showing your screen and you are showing an email. Did you mean to do that?
I do.
Okay. All right. So I'm Shirley Gutkowski. I'm the owner of Primal Air, and I practice today as a myofunctional therapist. And Victoria DaCosta, you can introduce yourself.
Sure. I'll stop staring at my screen. I am Victoria DaCosta, and along with Shirley, we are advocates for Upstream Intelligence, and we're here to talk about how to shift the world into collaboration, especially the world of healthcare, from sick care to well care. And systems need to be changed, and I am an advocate with Shirley that we discuss these systems, and I'm very excited about today's topic, Shirley. Very excited. Because
Well,
I am all about systems and creating new systems, right?
Yes, but it's got a bad pall over it because it's a really sad story. But it just goes along with, or maybe it's the ultimate outcome of the failed system that we've been talking about since whenever we started in December, whatever, of 2024. And so I got an email or a text message from the daughter of a patient of mine who I'd been working with for over a year. And she came to me in the most unusual way, in that she was referred to me by a doctor I'd never gotten a referral from. This doctor also does very much the same things as what we do at Primal Air. So it was a little bit like, that's weird. And so I was like excited, and it was a little bit weird and a little bit exciting that she's finally sharing patients with me. And my colleague here in Sun Prairie did the initial assessment. And after the patient left, she said, she's way too complicated. I don't want to see this patient. And so now there's two weird things, because she's super mild, right? My colleague, and she'll just do whatever I say. She's one of those kind of people. And for her to say no to a patient I thought was weird, but okay, I'll do it. I'm up for a challenge. I can fix this chick. And so we started on a treatment plan. She was in a moderate amount of pain at the time, and she was taking some kind of pain medication, and she was getting a lot of benefit from our treatment plan out of the gate. And I was pretty excited by that, and so was she. And then she started to tell me that it was hard to get all the exercises in, because now she's working with a breathing coach, and she's working with PT, and she's working with this other person. And I'm like, why are you mixing so many things up? You need to kind of decide. You just paid me a boatload of money with no insurance. And why wouldn't you prioritize what we're doing? Because you were getting some good benefits. Well, I just wanted to blah, blah, blah. So she put all of our stuff onto a back burner as she was working her way through these other things. And she was probably offline for 4 or 5 months. And then when she finally came back, obviously we lost a lot of momentum. So we kind of had to start over. So now, as a business owner, I'm thinking to myself, I'm losing money now every time I see her, because now she's not making the progress she was making. And I've really committed to working with this lady to get her mouth in the right order. And I did identify a restriction in her tongue, and that needed to be released. And so I referred her to a dentist, and the dentist, so not the one who referred her to me, because she didn't even identify that. And I think she probably just looked at her and thought, she's really too complicated. I don't want to get involved. And the dentist that I referred her to then had the same feeling. So I'm like, okay, how do all of these other people know how to read this kind of person and tell her no? The patient also called the lady who was in charge of the outfit that I was trained at. And she had a phone consultation with this lady. And this lady called me the off to the side and wondered aloud if she wasn't just drug seeking, because she was, always fighting. Do this. Well, I can't. Do that. Well, I can't. Do this other thing. Well, I don't want to, or it doesn't fit with this. So she would always have a lot of pushback, which we're finding is coming from a lot of our pain patients. So the new dentist then was like, I think we're just going to focus on arch expansion so that she has more room for her tongue before we want to do anything else. And that dentist was very nervous, too, because she was afraid that the patient was expecting far too much from the treatment, from the tongue tie release, and that it would be a very big disappointment for everybody. And she was just super nervous about it. And then her daughter started seeing us, and she was in a similar kind of a situation. A different dentist that I referred her for her tongue restriction didn't want to mess with them because she was so difficult in the chair. This hurts, that hurts, I can't lay like this. If you can do, she was just too high maintenance. And this is what we see in our pain patients. So the interaction I had with the initial practice was zero. The interaction I had with the first dentist I referred the mother to was moderate. We even had an online consultation between the three of us, so that was pretty good. The daughter that I referred to that dentist and I only had like 2 text messages back and forth about how she referred her to anybody else. Then the daughter had a great result with the tongue tie release with this other dentist in town. And the mother was still struggling. And she went and found herself a TMJ doctor. And now we talked with Dr. Chan a few weeks ago, who's also a TMJ specialist. And this TMJ specialist put her into an orthotic, which is, step 1. And she was a little better. She was excited about the treatment plan, as you always are when you're thinking you finally got somewhere. And he never called me. I never called him, which is a failure on my part. I still have this white coat problem that I don't know. I'm going to have a counseling session with ChatGPT or something to get that ironed out. Because, I know what I know and I know what they know, and the two don't always meet, and the potential for me saying something spicy is really high because that's how I roll. And so the last time I saw them was maybe in March, and they wanted to keep talking to me. I'm like, dude, my office manager and my CPA are going crazy for all of this time. I'm going to have to charge you. And then that was it. Never heard from them again until July 4th, when the daughter let me know that the mother had committed suicide from unrelenting pain. So I was like, oh my God, how do I even process this? This is awful. I did what I could. I completed our treatment plan, and the effect of the treatment plan completion was about 50% resolution for what my goals were. And she was still on pain medications. She was getting worse. And what was my role? So I went to, I don't know, Copilot or one of the chat things, and I was like, okay, these are the things. How do what do they call it? A mortality thing at hospitals when a patient dies unexpectedly, and then all the doctors get together and they have it out. You should have done this, you should have done that, or how come you didn't think of this? So that kind of a thing, which is what I was looking for with this AI generator. And I came across a really nice document. And what it said like 3 times in a 2-page document about the patient being heard. And I thought, that is such a freaking cop out. I can't even believe it. That it's blaming the patient again. The patient, I heard the patient felt heard by me. The patient felt heard by this other TMJ doctor. The patient felt heard by this other dentist that did the arch expansion. She felt heard by each of those people, but she was still saddled with the entire volume of information that she had to, what do I want to say, metabolize. She had to figure out from all the things I said, compared to all the other dentists, compared to her PT, compared to her TMJ guy, compared to her OT and all of these other practitioners, the patients are not prepared to do that. They cannot do it. They can't do it ipso facto because they only went to school for whatever they went to school for. Maybe they're really good at muffler repair, and you can talk to them about muffler repairs all day. But when you talk to them about their health and their health care, and you've got 5 different practitioners that have zero communication, that is a problem with the professional curiosity and professional responsibility. That's how I'm seeing it. And my failure was to not communicate with all of these practitioners. And then the other piece is that when I do send a report, I get nothing in return. I would expect to at least say, thank you, received, oh, this is big, or this is new, or something like that. So it really just brings home this whole thing that we've been talking about all these months about practitioners collaborating, not just collaborating with the patient, because there are multifactorial different things that are impacting all of this. The information we gather, we take really good photos. We're now doing thermography. Thank you for teaching me how to do that, Victoria. So we've got, all of these data points that we request x-rays from these doctors, and we're not communicating.
Well,
2 cents, happy to have him. So that's the first you've heard this story, right? Other than I think we talked on the phone for
a little bit, yes. And having Germanic roots in my life, in my genealogy, very, very keen on systems and building systems of communication. That was my major in college, communication. And as I listened to this story, the Copilot or whatever AI you use to break down was correct. The patient was so confused with mixed messages that they were lost in the sea of information and direction. And one of the tools that you kind of threw in, but it actually should be the base tool, is infrared imaging, bar none. Mm-hmm. Infrared imaging will give you documentation, which is scientifically proven, to base measurement improvement upon a visual scan that people can actually see their improvement and lock it in. And I would have had her case. I'll switch over to my screen because this is very true. When you have pain cases, they're in a different state of processing
Exactly.
information because they're uncomfortable. And so what we have here out of the gate is a software system that I designed and invented called DMT. It says Dr. Links here, but it's really DMT. And I have no idea why it's saying Dr. Links. But DMT here is what we're looking at as a overall process with the greet, screening, and what's next. So we have the greet here with patient values, patient status, and how quickly they want to progress in their care. Now, I created this because of just what you said. Where were her values? And we could look at her values differently. The dentist and the referral team that you had looked at, a lot of her values separately of what you looked at, and having a common language is key to collaboration. So here we would talk about evaluation, and that would come with the person taking the scan information and putting it into the documentation of the software so that we have a cohesive message about this particular case. Every case has their own um, uh, path and journey. And so here, I find it interesting that when I take this information, I'm surprised myself because they come in and if I really think about where they're at, I might put them in Uber versus a car or flying. And the reason is the mode of transportation, how quickly. Um, and this one case I did see, I put her in Uber because as I thought about her and I listened to her go to so many different sources to get well, she wanted other people to get her well. She wasn't willing to take the
Mm.
responsibility of doing her own care of like you said, doing the tongue exercises. She wanted someone else to take the responsibility. So knowing this in her value system made it easier to conversate, knowing that if I'm going to put her with a provider, it better be a provider that's going to carry her into this care of responsibility. And and they feel like they're being transported. And then there's other types that say, I don't need the extra care and the new I want to say nutrition. I want to say what's the word I'm looking for? Nurturing. Okay. It sounded like the case you were talking about, she was nurtured and she needed nurturing. And so someone in this
Yeah.
position would take care of that nurturing for her to give her the security that she's safe. And so in her care, she panicked. And when we don't have this understanding of who they are, and I call it patient snapshot, like what's important to them? Is it money? Is it their appearance? If it ain't broke, don't fix it. They're interested in prevention or they're time sensitive. And this is very key, Shirley, because as a dental hygienist, we get these types of people in our chair, or I used to. And so I started I started to uh, categorize them into these different types of values and would educate accordingly. So I would say, if I did recommend a treatment, I would listen to their response. How much is it going to cost? Okay, so they're concerned about money. And then or is it going to take that puffiness away so I don't have that red look appearance? Or I would hear, well, I don't have any pain. It doesn't hurt. It feels fine to me. Why do I need the treatment? Okay, well, your gums are broken, I would say. I didn't say you had gum disease. I would say your gums are broken and you need to fix it. And then I would hear, oh, all right, I need to fix it. Or it would be someone interested in prevention. I would say, well, you want to have your teeth when you're 95, right? You don't want to lose them. So that's why we're recommending this treatment for a higher quality of life. It's prevention. Oh, yes, of course, absolutely. Or I would hear, well, how long is it going to take? How many appointments? Then
Yeah.
I would hear they're time sensitive. So then I could say, put them on this time sensitive and money concern, whatever. Not all of them are going to be, they're not all going to be the same values. And so had I had someone in my chair that was concerned about cost and how long it was going to take and they needed to be driven there, I'm going to choose my providers according to their values because they won't get the results. And even though they're good providers in other areas, I
That's a
I
great
actually
point. Yeah, I
I
never
actually had to,
figured that in.
yeah, I had to do this. And then when I actually graded their motivation, dexterity, and anxiety and receptivity. Now, here's something interesting. Their motivation. How motivated are they to change? Sometimes I get people that are just right on board, or maybe they're a one. Meaning three means very motivated, one low or none. They're not motivated at all, but why are they here? Because the insurance
Yeah.
is going to pay for it. So I have, these different kinds of motivation. Dexterity. What's their dexterity like? My older cases, they have shoulder issues or mobility issues. They can't bend over. So I want to know what their dexterity is like. Can they pick up a glass and not drop it? Now, what about anxiety? This is key because anxiety means they're nervous. They're nervous about their future, they're nervous about their care, and they're nervous about getting results or not getting results. So I want to grade it on their anxiety level because otherwise I won't know the right practitioner to refer them to. And the provider, will look at their motivational skills, their dexterity, their anxiety. So if they're highly motivated, they have, pretty good dexterity or, fair dexterity, but they have a level of anxiety. I know that I have to speak in a tone of language that's going to calm them down and reassure. This is a person that needs a lot of reassurance that they're on the right path. Now, interestingly enough, they might be motivated, but not that receptive. Receptivity comes with the actual scheduling, or they're half listening, or they're like, yeah, yeah, it works, but you can tell, are they really listening to me? Are they receptive to the message of the care that we're talking about or their condition? And receptivity could be none or it could be high. I've had cases where receptivity is, I've mainly seen twos. I haven't seen too many ones. People that are not receptive are not usually in my chair or in my presence. You're usually two, which means they're receptive, but they're not 100% there. I don't have they haven't been bought in. They're not completely sold. Meaning they're not convinced. They're like listening, but they're not, yeah, I sort of get it, but I don't really believe you kind of mode. And this right here tells me if I'm dealing with someone who's, how much is it going to cost? How much time is it going to take? Am I going to spend a lot of time talking about prevention? No. I'm going to talk about how much it's going to cost, how long it's going to take. Their motivation is there. Their dexterity is there. They have some anxiety and they're somewhat receptive. Now I have a way of, and a system in place to communicate with them. And they like it because I had a case just like this. And this person said, what I want to find out is, why I have to take naps so much. And I wrote it down, even having the software just so you know. So why do I have to take the naps? Well, why do you have to take the naps in the afternoon? That was their main concern. They wanted to find out from my investigation of their infrared scans using dental records. And their complaints was no complaints here. And then the medical was, I'm always tired. And the magic one was, I want to have more of an energy. So even in this, their complaints might be always are different than what the direction they want to go. So right here, a snapshot gives the collaboration information for the practitioners or the providers involved to read the responses. And I put all of this response in what I have here is I have it in, I generate a provider summary report because this provider summary report is important for everybody to read and find out what this snapshot is. Now you know where you're, and then you can write your comments. Yeah, I also put it in the report here that the generation are the private comments go in between the practitioners and the providers. For example, if I'm scanning and if I'm in the head and neck area and I'm doing some infrared imaging here. This is just a test case. We don't have anyone in here, but here's professional notes. Everything in here is not seen by the patient. I'll put in whatever here information to communicate. And believe me, I use a lot of that all the time because I pick up on things that they need to know between each other that the patient doesn't need to know because it's between the providers and the professional people. But more importantly, in that introduction stage, when you're meeting somebody for the first time and you're planning out their journey, and she didn't be hurt, this is an important snapshot to take information wise and start listening and even ask, well, what do you mean by that? Or what experiences have you had? And listen to they will tell you their story. They'll say, well, I spent a lot of money and I haven't gotten anywhere, and it's taken me a lot of time to get there, and I'm still not there. What do you mean you're not there? I've gone here, I've gone here. Why you go, like Shirley, how come you've gone to so many different places? Because I'm not getting the results. Okay, well, what are you expecting? Well, they should do this and you hear where I'm going with this? Instead
Yeah,
of
I hear
I've
that.
done
Yep.
this and I've done that and I still can't get anywhere. So she's an Uber. So she wants to be transported. So I have this testimonial about this system here. It came from a provider that spoke with I provided this person with the right provider who he gets you in and out, and he's very good at what he does. He's a chiropractor, and this person, I could tell when I graded him, he was here, he was receptivity, he had some anxiety, he had okay dexterity, and his motivation was around two, and it was money and time, and he wasn't so interested in prevention as he was as it ain't broke toe fix it, and he wanted to find out why napping in the afternoon. So um so here we have napping. So why did he have to take naps in the afternoon? So I already had something to go with. I'm like, oh, he won't be good with somebody who's going to explain it to him. He just wants results.
Yeah.
So I put him with the right chiropractor because he had compressed disc in the neck and he had poor circulation and he had taken the vaccination. So I knew that the circulation was going to be affected because he had taken the vaccination. And then I also put him with the right bodywork person. I put him with a bodywork person that would be very, very nurturing. I think he was more like a car in my understanding. He wasn't so much like a plane, but he was, he wanted to drive himself, but at the same time, he was between Uber and car. So I put him in a car. And then I put him with the right body work. And then I put him with the right uh, wellness clinic that it's not really a clinic, but it's a studio area that has all the frequency equipment, and the guy that runs it is an engineer, and he knows how to deal with pain and also increase frequencies in the body and energies. It's a lot of equipment. It's beautiful equipment, state of the art. And so I put him in those areas to start with, and he's in the last week. The first treatment with the chiropractor, he came up to me and he said, I can breathe better. Well, yeah, because his ribs were compressive. I saw everything in the infrared scan. Everything was sewn. By the time I did his screening with the infrared and I took his information, I had information about his chest. I had information about his gut. I had information about his spine. So when I, looked at his spine, I could see everything that was there. Um, I mean, I had so much good information on him. I had information about his bite, how he was chewing, and how it was affecting his neck. I had information about his tongue. I looked under his tongue. It was very wide and it was covering his teeth, and I could see no airway. He actually had very little airway. I looked at the x-rays. I looked at the circulation in the teeth. I said, well, he's got some circulation okay, but in the molars, he's not circulating. What's that related to? Well, then down in the library, it will show you in the thermography scan or the infrared scans all the teeth that are circulating in these parts of the body in the chemistry, mechanical, and electrical areas. So I had a lot of information to go with, and I looked at how many teeth had restorations on them, and I looked at the circulation issues with the cranial nerves. So I knew this guy was in need of care based on what I saw. I'm not, would I love to give him the ideal treatment? Heck yeah, but I couldn't. I
Yeah.
had to put him with the right people. And so
Right.
this was the response. This is the from the provider. He asked this provider that was doing body work. He asked, "How did you and I know how to fix his issues?" This was him asking the body work, and her name is Shaylin. How did Shaylin and Victoria know how to fix his issues? Because he had spent up to $40,000 by now and he
Oh my
wasn't
God.
well.
Yeah. See.
I answered Victoria's scans, and it's really the DMT scans, showed what needed to be done, and we collaborated. She's so great. I suggested he get a massage at least once a week. As he left, I noticed his left leg was bothering him. He said he's going to get chiropractic treatment and red light therapy, the providers I recommended. I said, that's really fantastic treatment, and we're here to help. I explained to him about self talk, and he also suffered from depression. His wife told me
Mm.
off record um, that many of us speak badly to ourselves. This was put in the professional notes that he didn't see, okay? I put it in there because she gave me that information.
Yeah.
Badly about ourselves, and don't allow others to speak badly to you. Take back your worth. Give yourself empowerment back. You're worthy. She just snuck that in, and then he left.
Hmm.
And there was more in her text message about how he's excited and he's feeling better and he's got
Right away.
Sure,
Yeah.
right away. So this is why, when I go and I see this, if I didn't have this system, and Shaylin had a copy of this, so she could see in the report, she saw all of this information. She had my notes and she read it all and she saw the images. She knew where to focus on, and her language was right in harmony with what he wanted to find out and what his magic wand was. So she stayed within the journey. He needed relief of his low energy, so she gave it back. She opened up circulation and oxygen flow. And so he's feeling a lot better. Wait, how did this work? He thinks it's a mystery. There's no mystery. It's just we're
It's
communicating.
collaborative care. Yeah.
Yeah,
You're
but we have this,
communicating
we're
with the right
using,
practitioner, which
well,
is the key
well,
piece.
it's the language.
Mm.
In DMT scans, I'm able to put it in a language in a system that everybody understands. And I didn't even talk about the scoring system in the evaluation, and that would come in training about calculating a DMT scoring system. But what we're looking here is we're looking at a similar communication system. For example, as a clinical dental hygienist, I worked in over 600 offices temping, and every practice I went in was the same, a little different, but the
Yeah.
system was the same. I walked in, there was a front office, there was a back office, there was a room for me to work, there was the instrument drawers, there was the sterilization, there were the forms, there was the computer. I mean, do you see where I'm going with this?
Yeah.
I had familiar systems that I didn't question. I could just walk in and, the patients were different, but and the doctor was different and the front office was different personnel, but the system was in place. And
Yeah.
that's the key, is what we're trying to talk about in this collaboration, is creating a system of collaboration. And um, in the Dr. Link system, we talk about, having that, system in place using a software, because everybody can put their information into it, have access to it with the link, look at it, read it. We're working on more special features and special effects and better educational
Yeah.
videos. This is just our first version out, but what we're trying to do is educate even the providers to use it. If they're not going to use it to collect the information, we will give them a report to use to read. That's the same report the chiropractor has. In that case, the chiropractor had the same report as the body work, and as the person at the clinic, I gave him information off the report, and he's not a practitioner, but he runs the equipment, but he knew enough that where to direct him based on the report. Unless I have a report, I don't know. I have no idea what their story is. I've got to collect
Exactly.
it. So in
And I
in
think
her,
one of the things that this also solves, Victoria, is that
yes,
patients don't like repeating their story of woe to every single practitioner. And
true,
and you know, and
right.
they I do. I feel like a pain in the neck patient when I've got this long list of things to complain about that really aren't all that bad,
Uh-huh.
but you know, it's not, it's up to the practitioners, it's up to us, it's up to, now we have a better system to communicate with. The doctors in
Right. Hmm.
XYZ HMO have a system that they communicate with if they use it.
Right.
But this is short and sweet and to the point.
Well, it took me several years to
Yeah.
figure this out, and it wasn't
Mm-hmm.
something I figured out overnight. It was
Right.
the
Just needed
blessing I had.
focus.
Yeah, the blessing I had was working as a temp dental, doing temporary work as a temp substitute dental hygienist. Every
Mm-hmm.
day I was in a different office for 2 years, and it was over 600 offices, and I started to see what worked and what didn't work. And what didn't work was the patient coming in saying, "Well, I said that last time. Didn't you write it down?"
Yes, yes. I hate that. I already told you all of this, or did I tell the other guy and then you're lost? So to have a single communication tool like this is it's potentially a really big
Mm-hmm.
communication tool and problem solver.
Right. Exactly. And, it's just amazing to me how um, the 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 overall, it's really sad how you see these cases come in and it's something that you could have helped with had you had the communication systems in place. And I also heard, I also would view the patient would come in a dental clinic setting, talk with the dental assistant, pour out their heart, tell
Oh
them
yeah.
everything. And then the doctor comes in and the dental assistant maybe gives 10% of what was heard by the patient. And the patient sometimes sits there quietly thinking, I guess I don't have a voice. She filtered it for me, so I can't really tell him that. And they sit there quietly and they take whatever and the dentist doesn't know. The dentist had no clue that, this was going on.
Right.
So right there, the system was broken at the time that the information was transferred to a dental assistant and not to the source of providers doing the treatment. How many
So
times
I
have I
want to
heard that?
point out this happens not only in dentistry, this happens in medicine as well.
Oh,
The chick
absolutely.
comes
Right.
in, usually it's a chick, and she takes your blood pressure. She doesn't even remember to get your legs flat on the floor,
Right.
this arm or that arm, through the shirt, not through the shirt, takes your temperature, takes your whatever other vitals, types out all your medications. And then the doctor comes in, he's like, "What medications are you taking?" I'm like, "I already went through all of this. I
Right.
hate repeating myself, especially within the same 10 minutes."
And it happens daily.
Oh, all day. Yeah.
Can
All
you
day for
imagine?
every patient.
Yeah, and what we see is as much as we have cell phones and digital electronic, I mean, our progress in computer technology, we really haven't done much with the communication systems in the healthcare, have we? It's kind of
I
still
think
working in
Epic
the
would
1950s.
disagree with that. Yeah, no, Epic is huge. Next
Yeah.
time you come to Madison, we're going to have a tour of that place. It's enormous. They are making hand over fist money. They have a campus that's 40 acres or more. It's an enormous outfit, and they have communication systems within each hospital. Then recently I found out they don't communicate between hospitals. They all each have their own little thing. I'm like, okay, so there's a real tight communication between two hospitals here of three. Um, and they share patients, they share treatment rooms. I have a doctor that's affiliated with one, but my colonoscopy was at another. And so the communication systems don't communicate even under those circumstances. I'm like, dude, I didn't pick this hospital. I picked you, and you are supposed to be able to communicate with everybody else. I mean, why is that up to me? Why is it when you call there and the lady on the phone is like, well, I don't have access to that information? I'm like, well, I don't either. So where are we then? Where are we?
Well, I see that, and this is what I always say to my cases, you're your own best doctor. Do
Well, how is
you
that possible?
you're your own best doctor. You have ownership of all your information and start collecting and putting it in a file. And it depends on the person's, but more than often than not, depending on their value systems and everyone, they shake their head and say yes, because that gives them, I mean, they're driving their car, they're in it more than I am, and you're hiring us to find out what's wrong and look at it from that perspective instead of putting the responsibility on us to fix you. Hire us to find out what's wrong and do the investigation, and then it's your journey to tell us, and well, it's our journey actually to find out what is it that they want, and be specific and only treat what they want specifically. A lot of times in healthcare, we give them way more than they want to be
That
treated,
happened this week today.
and they're
This week.
overwhelmed. They're
Yes.
overwhelmed, and they shut down. So the most important thing is gain the confidence and the trust with one item, or maybe two at the most, and work there. The guy, he took naps. Okay, I started there. That's what he wanted to find out, and that's what he wanted to fix. I want more energy in the afternoon. I don't want to have to rest. All right, that's where we're going to start. It's your journey, not mine. And I'm going to put the right people with you because I know their work and I know how they work and how they are. They're happy, you're happy, win-win, everyone's winning because they get a case that's time sensitive and he's a time sensitive provider, and that's a good win-win. They like each other right out of the gate. It works. So
So you're a matchmaker behind the scenes.
we all are,
Yes.
really.
Yeah.
Really, we all are a matchmaker, and everybody's going to be matched differently according to their values. So it's something that I know in the mainstream healthcare system, they're not paying attention to the customer. You go to stores like Walmart, and I swear they they have really figured out customer, what the customer experience is when they walk in, to hello, to helping, to the music, to the checking out, to the aisles and how it's organized. They have organic food now and sections. They have international food, and they're always listening to the customer. In healthcare, I believe there's a little bit too much ego of, you come to me and I tell you, customer, what you need and what you should purchase. And if you turn that around and ask the customer, what do you want to purchase? You have a higher loyalty of a dedicated person to come back for your services. I think in the healthcare industry, they've gotten away from that mentality because insurance or because of no competition. I don't need to compete against another doctor for service because I've got insurance. They don't have that, you know, I have to, or I want to be desirable for that. If they're cash based, they'll do a little more advertising on their website, but I still haven't seen their menu change. And we talked about that. It's still a 1950s, 1960s menu.
Yeah.
And the thing is, they don't understand. The customer will pay for the upgrade. If you upgrade your services and combine them with your other services, the customer will say, you know what, I want to know. And I'm glad you added that to my visit. And we're doing that with the Dr. Links and also the DMT infrared imaging. We're adding more services of investigation that the person will be asking for because it'll give them more knowledge. So yes, it's all about empowerment with information and knowing that they are in control. When the person committed that suicide, she felt loss of control, loss of hope, and she felt there was no way to resolve.
Yep.
There was no resolution because of the mixed messages, and she also had fear of being in this pain the rest of her life, and she'd rather, end her life than be in this chronic pain and have a solution. She saw no solution, and she saw no
Right. She
hope.
thought she was out of solutions and out of hope.
Hmm.
And maybe
Very
she was,
sad.
and maybe she needed to be hospitalized to get to the bottom of everything,
Well,
but
you
nobody was
know,
going there.
right. And there was an emotional crutch.
Yep.
People usually are in pain because they're emotionally in pain
Two.
first. Yes.
Two.
And I've seen that many times, if not every time. There's an
Mm-hmm.
emotional element that needs to be factored in the collection of the information. And I find it every time. And I don't need to have, sometimes I don't talk about it with them, but I talk about it with the providers, just like Shailene said about empowering him with, feelings of empowerment. After he started to feel good, she reinforced, take your power back. You have strength and energies. And so she snuck that in. Now, thank goodness she did, because she wouldn't have known to do that had I not put that information in the report between the collaborators. So we all look like we're speaking the same language,
Yeah.
and we are cohesive. So when he goes from provider to provider, he's on a journey going forward, not backwards.
Right. So we do have a tool.
We have a collaborating tool, and that's why the software is a main artery for this and collaboration. And Dr. Links is going to be built out even more so, linking the communication and communities together, even on virtual. So um, more and more doctors are getting online with Zoom calls,
Yeah.
and nurse practitioners and naturopath doctors. It's exciting. I think we're going to have more and more of, um, this way we have more an easier communication using digital technology versus hard copies.
Well, this was a nice little trip through the software again and all these
Yes.
little secret things. I'm like, well, you showed me that before, but she didn't really have this good context to it. So, I was like, airplane, okay, they want to get there fast, I guess. But the nurturing component of being driven there or going along in a crowd in a bus or something like that
Yeah,
was lost to me for a little
these are
bit.
just symbols.
Yeah.
Yeah, they're
Oh,
just
sure.
symbols to show where they're emotionally at. Because if I put the emotionals there, and I'm trying to get that so that they, they're not feeling judged if they see on their scan that they're an Uber. But you know what? Yeah, hey, if it works, it works. And not everyone really understands the symbols,
No.
but we do as the providers, and I put
Yeah.
it in the training. And wouldn't that save you a lot of stress? Knowing if this was an Uber case, you would know. You would already know that's not a good fit with that person. This
Yeah.
person, and also you would probably even go, you know what? I'm going to put her with this person who does emotional release. She's in sympathetic mode. She's running from a bear, and she needs to get in parasympathetic. And that's what, I said with this last case. He's in sympathetic. He sleeps in sympathetic. He doesn't know what life is in parasympathetic. So let's
Yep.
get him in parasympathetic. And I put him with the people to do so. And it's working, but I had to fact find first using the system. And it's fun because I don't have to recreate it. It's already created. I just use it as a platform. And it makes it fun. And just a side note, I've spoken with a couple dental hygienists, and in our next interview, some of these dental hygienists don't want to do infrared imaging, but they'd like to get the images and put them into the software and the dental records, and use it to investigate on their own time and get paid for it. What a godsend, because
Yeah.
we can just give them the information, let them put it together and find the investigation out, take the time to do it. It's going to be way more cost effective. And I think that the dental hygiene profession has the most it has the most hours inside of a body in a portal of entry. The mouth here is the hole inside of a body that we spend how many hours and thousands of hours in? Not a nurse, not a dentist, and not a doctor, but a dental hygienist. And that's where we really need to, up our game in putting that out there for the other providers, because the understanding is we get it because we see it, and we're putting it into a report to pay attention to and document. So this is it's kind of fun. It's pioneering, like you mentioned earlier. Upstream intelligence is
Yeah.
we're going upstream, but the good news is there's good news, and we have a system that has been designed. And I took the information by not just myself. I collaborated with medical doctors from Europe and and chiropractors. I interviewed all kinds of professional and asked, what would you want me to look for? And then I
Yeah.
put it in there. And that way it became more of a standardized, systematic data intake that's repeatable every single time you
Mm-hmm.
take this information. And infrared imaging, bar none, I can't emphasize enough infrared imaging. And I want to just make one little side note. Infrared imaging is in the Superman movie scene.
Whoa.
Yes. There's one scene that it shows infrared being used by the bad guy to locate Superman, infrared imaging. So it's got its legitimacy now because it's in the Superman movie.
It's real.
It's real.
It's real. No, this is great. I'm real happy when I'm looking at these pictures that I'm taking, and then doing whatever I have to do to get the information from it more succinct. And the patients are happy to have an interior look. And I had a grumpy 10-year-old in here the other day, and I was, we take a lot of pictures in our practice. We take maybe, I don't know, 25 just pictures of the face and mouth, and then we do the posture pictures too. So that's 6 more. And then now we're doing 4 infrared images where we go, face and then side and back.
Wonderful.
And so he was kind of like done with the pictures. I usually do the infrared last. And I showed him one of the pictures, and I was like, "This is what you look like in a heat image." And he was like, you know, it's all these weird colors and everything. So that was pretty cool. It makes people think that we're doing something a little different, which we are, because there's not enough of that happening. All right, so we're cruising into an hour here.
Yes.
So this tool will help, because we were wondering, okay, so now I'm communicating with these people and they're not even saying thank you, or what is this, or something like that, so this makes it be a lot easier. And then communicating between the practitioners should be a pretty high priority, because the not doing it can be pretty dire.
Yes, and I would say vet your providers.
I'm
Uh,
just looking for good hands right now. I'm not
I
looking for
I
good
I agree.
emotional fits,
Interview
which
them. Go to
could
their
be
office.
bad.
Well, I say go to their office and interview them. Show them your
Mm-hmm.
information and see what kind of response you have. I've had to do that. I've had to literally get in front of them in person and say, I'd like you to be a referral. I'm thinking about having you as a referral source. Can we have a meeting, even if it's Zoom?
Yeah.
And say, what do you do? How do you do it? And get a feel for their personality, for their caring level, for their engagement, and for their excitement, enthusiasm about their profession. And, or when you sent that information, my first thought was, it happened to me. They didn't look at my scans. Did you look at them? Not really. I
Yeah.
glanced. No,
Yeah.
we don't want glancing. We want you to read them,
Yeah.
because your treatment is going to be affected by your reading the information and the person coming to you. I don't normally get thank yous from my providers. Very rarely do I get a thank you.
Yeah.
But we're going to build in a newer system in Dr. Links so that there's going to be more communication between the providers for appreciation. And this whole, it's like a black hole. If I make a referral, I
Yes.
get they drop into a black hole and I never hear anything else and I don't get a response. I want to have that response, and what we're going to have is a system in place for these providers. If they want to be part of it, they're going to have to respond. They're going to have to put a update on what the hell. Well, so all the other collaborator or the providers read it. They're not an island anymore. We have integration of
Yeah.
communication. This is a big problem because they keep it to themselves and write it in their own records, but they don't share it. So
Right.
yeah,
I don't get a copy of or a
right.
note that says he
Not
was
even a
in
note.
today
Right,
or she was in today and
right,
we did these
right,
3 things and they
right.
complained about you. Nothing.
Nothing. Right. Yeah.
Nothing.
And there needs to be also, I think, in place a coordinator. So if we're working with a coordinator, she's going to demand, I need your notes. Oh yeah, yeah, yeah. I forgot to write them or update them or input them into the software. So we're working on it, and it might be an AI coordinator we work with. So
Which is fine, right? I
yeah,
mean, we don't need a real
we
person. We just
no,
need some
we
kind
need
of a system to say,
yes.
didn't respond, and
Right,
then go
right.
back and
We get
make them
that when we don't
respond.
pay a bill.
Yeah.
The email comes every 2 seconds, your card didn't go through, and that's not a person, it's on digital. So, yes, we're working on all those new features in the next coming 6 to 8 months. We will have a lot of new things happening about this. So it's very exciting.
So our next Upstream Intelligence meeting, you will be speaking with another hygienist. I will
Yes,
be out of the office
yes,
that day. I'm going to be at a trade show. So, you got to get out there a little bit. And so I'm looking forward to hearing that in a delayed way.
yes,
So that'll be August 2nd, I think.
yes.
And
Uh-huh.
so there you go. My name is Shirley Gutkowski. Please feel free to share these episodes or comment below. I've been trying to make sure I answer the comments when they come up, and I'm excited about our little system here between
Yes,
thermalinx and
yes.
our Upstream Intelligent podcast. I think it's really going to be helpful for a lot of people.
Yes, and I'm Victoria DaCosta, and like Shirley, we're excited about our future, and I can be reached on my work on drlinx, drlinx.com. And if you're interested in participating, and we're going to be also searching for people that would like to be in our first beta, we're more than happy to include you and have user feedback as well.
See you, everybody.